Bronchitis is like a bad cold that settles in your chest. It happens when the tubes carrying air to your lungs, called bronchial tubes, get inflamed. This inflammation makes it harder to breathe. There are two main types of bronchitis: acute and chronic. Acute bronchitis is like a short-term visitor, usually caused by a virus. Chronic bronchitis is more of a long-term guest, often linked to smoking. Both types can make you cough and feel quite sick. It's important to understand bronchitis so you can take care of yourself and get better soon. Most of the time, acute bronchitis is caused by viruses, the same kind that cause colds and the flu. These viruses spread easily through the air when someone coughs or sneezes. You can also get it by touching a surface with the virus on it and then touching your face. Other causes of acute bronchitis include bacteria, although this is less common. Irritants in the air, like smoke, dust, or fumes, can also trigger acute bronchitis. Chronic bronchitis, on the other hand, is usually caused by long-term exposure to irritants that damage the airways. Smoking is the most common cause of chronic bronchitis. Other irritants that can contribute to chronic bronchitis include air pollution, dust, and chemical fumes. Bronchitis announces itself with a persistent cough, often the most bothersome symptom. This cough might bring up thick mucus, which can be clear, white, yellowish, or even greenish. Along with the cough, you might experience wheezing, a whistling sound when you breathe. Shortness of breath is also common, especially when you're active. Other symptoms can include a slight fever, chills, chest tightness, and fatigue. If you experience any of these symptoms, it's essential to consult a doctor to determine the cause and get appropriate treatment. Section 4. Finding relief. Treatment options. Treating bronchitis depends on whether it's acute or chronic and what's causing it. For acute bronchitis caused by a virus, rest is the best medicine. Your body needs energy to fight off the virus. Drinking plenty of fluids, like water and broth, helps thin the mucus and makes it easier to cough up. A humidifier can also add moisture to the air, soothing irritated airways. For both acute and chronic bronchitis, your doctor might recommend over-the-counter medications to relieve symptoms. These can include pain relievers for aches and fever reducers. If your bronchitis is caused by bacteria, your doctor will prescribe antibiotics. For chronic bronchitis, managing the underlying cause is crucial. If you smoke, quitting is the most important step you can take to protect your lungs. Section 5. Staying healthy. Key takeaways. Bronchitis is an inflammation of the bronchial tubes, causing coughing, wheezing, and difficulty breathing. It's essential to understand the difference between acute and chronic bronchitis to ensure proper treatment. While acute bronchitis is usually caused by viruses and resolves independently, chronic bronchitis often stems from long-term exposure to irritants like smoke. Seeking prompt medical attention, resting, staying hydrated, and avoiding irritants are crucial steps in managing bronchitis and preventing complications. By taking care of your respiratory health, you can breathe easier and live a healthier life.